Hello everyone, greetings for the day. I'm Priyanjali from All About Skin Wellbeing. I'm sure all of you must be keeping good health. We all know taking good care of your skin is important for more than just your appearance. As the largest organ, your skin becomes the most essential to your overall health. A fungal infection is very common on your skin or nails. Fungal infection or mycosis are diseases caused by fungus, yeast, or mold. Mild fungal infections can look like a rash, can be itchy and annoying. So let's connect today with our skin expert, Dr. Sonali Pinge, live from Mumbai, to enlighten us on the topic of fungal infection. Dr. Sonali is MBBS, MD in dermatology. She has many years of experience in this field and is currently practicing in Mumbai. Well, with that, we would like to introduce you to today's platform, ma'am. A very, very warm welcome to you. Let's start with the first question, the very general question. What is fungal infection in your language?
So, as the name suggests itself, fungal infection meaning fungus. The fungus which we consume are usually molds and mushrooms. So, the same implies with skin. And so, the fungus which grows on a protein in our body, which is very common in structures like skin, hair, and nails, that is the fungal infection which we deal with on a day to day basis. So, and that's the scientific word for it. It is called as tinea, which is very, very rampant, especially in humid places like Mumbai. So, yeah, basically, that's the fungal infection, which is common in the public.
Right. So, which are the usual areas where we get to see the occurrence of fungal infection?
So the fungus thrives in any moist environment. So the usual areas where we'll get fungal infections are the flexures, that is the folds, so armpits, groins, even in between toes. So now it also depends on the immunity of the person and how
Right.
prone that person is. Not necessarily everyone will get it at those areas. People can get it on the body, anywhere on the body. That's called as tinea corporis. It can happen even on the legs, the feet, which is not that exposed to the moist environment. But yeah, the most common sites are the flexures.
Right. Now, speaking of different areas, doctor, tell us, does different areas have different causes behind it?
No, so there are different fungus which are named according to their origin, basically. But it doesn't really depend on the uh, like it depends on the humidity and the environment mostly, and not the organism per se.
Right. Now we know a kind of fungal infection which occurs on the scalp. Um, so, what can be the reason, the basic reason behind it?
So it's because of poor hygiene. What happens is we visit these
Hmm.
hair salons and uh, items like comb. I know they are not intimate items like undergarments and towels, but still items like combs and other things which are used in the parlor. Like these are called fomites. Okay, the things which transfer an infection from one person to another is called as a fomite. So it can be anything. It can even be animals for that matter. So yeah, so it really depends. Like tinea capitis can also depend. That is tinea capitis, by the way, what you're talking about, fungal infection
Right.
which occurs on the scalp, and it also occurs because of an inborn tendency of that scalp. Okay, so it's not only because it's transferred from someone, but if I am a person who is more likely to get a fungal infection on the scalp, I will get it. So the only way to prevent that is to be extra cautious. You have to take extra care if you're more immune, I mean, if you're more prone to getting such infections, and using maybe an antifungal shampoo. So that should be regularly added on to your routine so that you do not get fungal infections of the scalp.
Right. Now, doctor, so we are saying that fungal infection is contagious, right?
Yeah.
It is contagious. So,
Yeah.
what about the people who are staying in a home environment? What kind of precautions should they take in order to, stop the spread?
So fungal infections are very, very common in a household. Okay, I've seen like if one person has it, it's most likely that they've gotten it from someone else in the household. So yeah, I would advise is keep all the towels and all clothes separate. Do not share your clothing or your socks or even your shoes for that matter. Then another thing I usually advise patients is to keep their nails trimmed, because we don't realize, so fungal infections are usually itchy, right? So the fungus
Right.
gets lodged in your skin, and it does, when we touch other objects, it might spread from one person to another person unknowingly. And another thing is, I also ask them if they have pets in their household, because pets do carry the fungus around. So
Mm,
then I would advise them to visit a pet, I mean a vet, if they have any signs of itching, or because fungal infections on human skin are easily visible, but fungal infections on pets are not easily visible because of fur. So that is one thing. And other than that, I would advise, if they're using a body soap, instead of a body soap, I would advise them to use a body wash, so that the infection is not contaminate, I mean the spread is not increased, because the soap can still hold the I mean, because the way you use a soap is different from the way
right.
you use a body wash. So that is another
Hmm.
thing I would like to add in a family setup if there's fungal infection prevalent in it.
Right. Apart from that, of course, not using their personal items amongst each other can be towels or say combs, as we were
Yeah,
talking about. Now, washing the clothes is a task. We always tend to wash all the clothes together. वो सारे कपड़े एक
yeah,
साथ जाते हैं machine में.
yeah.
Yeah, even if somebody is washing or giving your help to wash it, the clothes basically goes together. Um, Also, there is another scenario, doctor. Dry cleaning. When we send our clothes for dry cleaning, so is there also chances that it can get it from somewhere and then you know come back
Yeah, so
home?
that's also one thing I advise, because what happens, especially in the case of children, they go for these plays, and there are these costumes which they have to, where they wear it on rent. So ideally, whenever that is the scenario, and I've seen fungal infections
Mm,
predominant in families, I tell them to wear something inside, because
right.
unknowingly, even if it's steamed or anything, the fungus, I mean the bacteria, I mean the fungi still stay on that. So the extra precaution which we can take is on only on our side. You can't really do anything to those costumes, but wear a thin inner garment, or inner maybe a t-shirt or something, to create that barrier between that costume and yourself. And other than that, hygiene, basic hygiene measures, like having a bath as soon as you're done wearing those costumes, is very important. And yeah, that's the one thing usually people miss out on, but the little things need to be watched, because sometimes the fungus just goes on, and they are taking the due measures like using a body wash, but the infection still stays. So then you have to dig deep like a detective, and try to find out what the cause behind it might be.
Right. Now, this is a very good point which you have just mentioned. Uh, the costumes you're talking about, not only children, I believe, the entire entertainment
Exactly.
industry, yeah, they uses clothes on rent,
Yeah.
especially the dancers or the performers. The clothes are basically taken on rent. So, very important point. People who can relate to this, please make sure about the precautions you need to carry on while you are also using such clothes. Moving ahead, doctor, there is another kind of fungal infection which appears around the nails. Also, very stubborn, we know that. Mostly all the housewives who are in contact with water all the time, they tend to have it. So, tell us that is it possible to get it cured? Because the people I know, they have given up कि ये तो ठीक नहीं होने वाला है अब. So, is it curable?
So yeah, ideally, if it's worse, so it depends on which stage it is in, okay, and how
Hmm,
long
hmm,
you've been taking that treatment. So what happens is with tinea, I mean the onychomycosis, that's the nail infection you're talking about. It's very, very resistant to treatment. So you have to be firstly patient, that it's going to take a lot of time for it to go,
hmm.
and medication. So patient compliance reduces with obviously with frustration that it's not improving. So at least a year down it can reduce. So I always ask my patients, I tell, give them a realistic picture that yes, this is going to take some time and it might not go. So only if you're ready to get into that, then we will start the medicines, because firstly it's cause it's since it's more common in housewife. Why? It's because they are in constant contact with water. They are doing the dishes, and again, a moist environment. Fungus thrives in a moist environment. So one thing which you can do to prevent is wear latex gloves while washing dishes, doing the dishes. But I know it's not feasible for everyone. It restricts your mobility while doing the
Right.
household chores. So that is one thing. Either that, or you can use barrier creams, that basically moisturizers, Vaseline. These are the things you can use right after. And other than that, it doesn't. So I have seen few cases of it getting better, but it also
Hmm.
depends. If you're far into the stage where the fungus has gone deep into the nail bed, then yeah, it's not possible that it's going to go. We might have to resort to surgical measures in which we remove the nail so that the antifungal creams get absorbed better. But that's again a very painful task for the patient. So
Hmm.
as
Of
long
course.
as the, and then there are other underlying causes, like maybe if the person has diabetes, then I'll tell that person to get that in check.
Hmm.
And
Hmm.
just counseling for that matter, because yeah, nail infections do not go that easy, but they do reduce. I have seen good results of them reducing only on oral medicines.
Right. So, just asking, once the nail, as you were saying, of removing the nail, so the nail comes back again, back
Yeah.
like it was before?
Yeah, so the nail plate, the part which we see, we put the polish on, that is the dead part. Okay, but it grows
Mm-hmm.
from something which is called as the nail matrix, that is deep inside, like right over here maybe. Yeah, so it, you can't see that part. So that is basically the stem cells from which your nail is growing. So we are not
Okay.
going to remove that. We'll be just removing the nail plate for the fungus
Mm-hmm.
to be exposed at the bed, so that the creams get better absorbed. That's it.
Right.
We won't be
Right.
affecting the plate. I mean, we won't be touching the plate.
Right. Now, washing the dishes, as you said, doing the dishes is one kind of scenario. Recently, I have seen another kind of scenario where women are very much, fascinated by doing the nails nowadays. So, getting their nails done, visiting the nail salon has become a thing. And somehow the tools, they don't tend to wash it on a regular basis, all the tools which they use. So, are there any chances of occurring
Uh,
occurrence from the salons?
So, the moisture can be one of the chance, but if you're one of the chances, but if you're talking about spread, that is highly
Mm-hmm.
unlikely with fungal infection. But what I'm more like, for when people visit salons, doctors are more afraid of bacterial infections instead of fungal, because
Mm,
bacteria, I mean, fungus is still, because they are shiny instruments, it can easily get washed off. Basic hygiene, I'm pretty sure any good parlor will do. But because of the way they handle the skin and the cuticle around, that makes the nail more susceptible to bacterial infections instead of fungus.
right, right. Uh, Also, doctor, uh, there is another kind of fungal infection which spreads through the regular use of public toilets, say
Hmm.
fungal infection in the groin area. Very common for both the genders, especially for women. It's painful. So, what are the kind of precautions they should take in order to get rid from it or stay away from it?
So, public toilets, if you're using the kind of, if you're, I mean, you're sitting on the seat, then it's a different issue. Then you have to resort to hygiene. But I don't think that's going to be a daily affair, right? It's just a one off thing, and you might get that infection because of a one off incident. But other than that, I would recommend, do not either carry a disinfectant spray, which are readily available, or I still do not, as my personal choice is not a disinfectant spray, it is the toilet seat covers, which are better off to prevent. And other than that, I would just recommend not to sit on a public seat, because uh, that is one of the reasons where fungal infections. And other than that, there are a lot of other hygiene issues which can be caused.
Mm,
But yeah, there are so many products which are available in the market, like toilet seat covers and disinfectant sprays. I don't really see it transferred because of a public toilet.
Right, right. Now, there are also products like vaginal washes in the market. Is it safe to use them? Actually, there is a controversy going on. Half of the
Hmm.
crowd believes that it's not required to use such products for the women.
Hmm.
Um, and the other half, they have a tendency of,
Hmm.
smelling good all the time. So, tell us that, is it really safe to use such products?
No, I really do not advise. So, our the human body is an amazing piece of art. So, I believe that there are bacteria which are there on our body, especially there to protect you. Okay, so
Hmm.
that's why there must be some. I guess you've heard of something called as vaginal candidiasis.
Mm-hmm.
So, in which there is a white discharge which females get from the vagina, that happens mostly because the person is on antibiotics for some other reason. So, when the person is on antibiotics, these are defense mechanisms. I mean, the bacteria which are actually protecting us from these fungal infections, they die. And that is the reason fungus thrives better because there's no protective defense against them. So that, and now coming back to the vaginal douches that you're talking about, what happens is, yeah, there are pH controlled ones, but why do you find a need to disrupt your natural flora, which can lead to these infections? So ideally, I would recommend never go for these vaginal washes, and it's just normal soap which you can use. There's no need for perfumed, and many people, because of the perfume which is added in these vaginal washes, end up getting an allergic reaction to that as well. So I would recommend stay clear of, like, stay away from these washes.
Right. So now speaking about the white discharge, we women are very much common with it.
Yeah.
But what if the person is not on antibiotics and still having it? What can be the cause behind it?
There are multiple causes. One is basic hygiene. If you're wearing tight fitting clothes all the time, that obviously
Mm-hmm.
creates a moisture, moisture wicking. Always wear moisture wicking clothes, breathable clothes. Another thing is uncontrolled diabetes. So fungus thrives on increased sugar in our body. So either
Mm-hmm.
it's not necessarily you need to have diabetes, but even intake of sugary food, that can also be one of the reason. Then, other than that, there are various immunocompromised states like HIV, or maybe if you're taking steroids for some other underlying condition, that can also be a
Mm-hmm.
reason for vaginal candidiasis. Then, having not maintaining hygiene during sexual intercourse can also be another reason for having vaginal candidiasis. So, now coming to the sexual intercourse part, it's not a sexually transmitted infection, but what happens is when different things are added inside the vagina, that time the pH balance gets disrupted, and hence it helps in it's a conducive environment for other bacteria to grow. So it's not a sexually transmitted infection. You can't really catch it from your partner, but because if proper hygiene is not maintained and new bacteria are getting introduced into the environment, that's the reason vaginal candidiasis can also occur.
Right. Very well. Doctor, now moving ahead towards the next question. The treatment options, let's know about it. Let's know about the initial process. How do we diagnose the patient? And then further, how do we proceed with the treatments?
So now again, different there are different presentations of fungal infection in different parts of the body. So like candidiasis occurs if it's in the vagina, it's going to be a thick white discharge. If it's between your toes, it's going to be a white layer of tissue. And on the
Hmm.
body, it usually, the one which we are talking about on a daily basis, is something like red erythematous, like red patches appear on the body. They usually are scaly and they are very itchy. So now again, there are different treatment options for different fungal infection, and each fungus gets affected. I mean, it's treated with a different antifungal. So when coming to candidiasis, it's fluconazole, which usually has a good effect on the. I mean, it's used as a treatment. And tinea, that's the other red patches I'm talking about. There are a lot of antifungals available. So I'll just name it out for you. That's terbinafine, griseofulvin, there's itraconazole, and also the majority of the big classification is called the azoles. Under that, there are a lot of azoles like itraconazole, voriconazole, fluconazole, posaconazole. There are a lot of antifungals.
Right. Now, speaking of antifungals, which you are mentioning, the ozoles, doctor, recently we have found out that the medicines are not working for the patients. Might be possible because they are taking it on themselves. Self medication is what they are doing it on a regular basis, and gradually the medicines have stopped working. So, what can be the basic reason behind it?
So now fungal infections, because they are so common, instead of going to a doctor, they like to self-medicate. It's maybe someone in the family had the same thing, and it's like your relative or friend who medicates you, else you watch it over the internet and then they medicate themselves. So what happens in these things is fungal infection, also any infection of the skin, takes some time to go. So the patient compliance reduces a lot when they take over the counter drugs. They just use it for around a week or so. Then they are frustrated that it's not working. Then they'll go to the next best thing. And so what happens because of the entire process is incomplete treatment. And because of
Hmm.
incomplete treatment, the fungus usually gets resistant to the antifungals which we prescribe on a regular basis, and then after a while those antifungals do not work. So then hence the cycle is like a continuous cycle where the patient is frustrated because it's not working. They stop the treatment, they go to another dermat or maybe a family friend who will recommend something else. So yeah, that is basically what happens when you take over the counter treatments. You do not really comply with it, and there is resistance build up which happens.
Right. Now, doctor, speaking of that, can long-term taking of this fungal infection somehow affect our health? Also, is it safe for pregnant women's to take such medications?
So I'll answer the pregnant women part first. So that is so most of the azoles which I was talking about are pregnancy category C. So there are different pregnancy categories um it's for the doctors or even for the public for that matter to be aware. So there is A to D and there is X. So A is usually safe. It's safe in pregnancy. As you go like down the alphabet, that's D. It's not safe. Okay, so the azoles which I'm talking about are mainly fall into category C. That means basically what is category C is that the animal studies of those drugs show that there have been effects on the fetus. So that means it's not going to be safe for the humans as well. So I do not recommend oral antifungal treatment in women, especially till the third trimester. I mean, till the first trimester end at least, because that's when the organ development is happening. And if the fungal infection is not that severe, I will not even recommend it post the first trimester. Topical antifungals, yeah, are safe to give in pregnancy, but oral antifungals, I would like to not use them for the 9 months. Now, coming to the side effects, I mean, the prolonged use of antifungals. So, yeah, a lot of things, they are not completely dangerous, I would say, but a lot of things need to be taken into consideration. So like for onychomycosis, the nail fungus infection, which I know is going to take some time for it to go, maybe a year or two, that time I would like to monitor certain things like liver function tests. So these azoles usually can be damaging to the liver if taken for a prolonged time. So yeah, there are people who self medicate and then they visit one dermat to another. So they've been already taking it for like itraconazole for around 6 months. Then I would like to repeat a liver function test for them. Other than that, there are few antifungals which have an effect on the kidney. So renal function test would also be required. And they are safe, but it's always good to monitor liver function tests and renal function tests when you're giving. And after that, I would also like to take a history. Like if a person is taking different drugs like oral contraceptive pills or oral anti-diabetic medicines or anticonvulsants, these drugs can interact. So then again, I would be a little more cautious while giving itraconazole or any antifungal for a prolonged period of time.
Right. Uh, Doctor, the major issue with fungal infection which people are facing is it has the tendency of occurring again and again. So the basic reason behind it, and how can we get rid of this issue?
So, like I told you, the basic reason behind is patient compliance. We are very like people do not follow the treatment given by one doctor. Over the counter medication is also another reason that this happens continuously. No skin treatment, however simple or basic it is, should be self medicated. You should visit a doctor and give proper follow up. That is one way to avoid it. Other than that, basic hygiene measures which I advice in the beginning is try to find the cause. If maybe someone in the family or a close friend has it, and you're using personal belongings, clothes, shoes, socks, that might also lead to fungal infection. And then other than that, if yeah, your obesity is also an important factor because the flexures are more prone to friction and moist environment. So if you are getting recurrent fungal infections, that also might be one of the reasons. And other than that, there is immunocompromised states like diabetes. The fungus thrives on high blood sugar levels within our body, so that also can be one of the reasons for recurrent fungal infection. And other than that, yeah, that's basically pretty much it. Yeah.
Right. What about dietary follow-ups or dietary restrictions? Any do's and don'ts in such case?
It is a very common thing among people who have diabetes, or even for that matter, people who have high sugary foods on a daily basis. There can be a young person in whom diabetes is not really identified as of now, but yeah, if you are eating junk food or sugary foods for that matter with high glycemic index, then yeah, there is a chance that less likely for the fungal infection to get cleared off faster.
Right. So basically, we are focusing on sugary foods here. Avoid
Yeah.
sugars and fast food and junks or oily
That's for
food
any
and fat
infection.
food.
That's not just, yeah,
Right,
not just
right.
fungal infection, for even for bacteria.
Any, right, right. And speaking of such food and sugar, of course, um, is the worst thing you're doing to yourself. Anyhow, it's going to hamper your health, not just for fungal infection. Today we are talking about fungal infection, but try and avoid such things from your diet, and you will definitely see a major difference in your health. Also your lifestyle, also your sleep cycle, everything can change, just if only if you change the basic sugar and, as mentioned, fast food. घर का खाना खाइए, बेसिक सादा खाना घर पे बना के कोशिश कीजिएगा, कम तेल मसाले यूज करके खाइए, एंड देन trust me, you will have the best life, the best skin, the best hair, and the best sleep, which we love, of course. So try and change your food habits a little. It can solve a lot of problems, majorly all the problems. Moving ahead, doctor, I can see a few questions coming up from the viewers. The first question comes from Pooja Sharma, who asks, are yeast infection linked to diabetes?
Yes, definitely. If you have, so anything which will reduce your body's immunity. So again, diabetes, the high blood sugar levels reduces your immunity. Other than that, if you're on oral steroids for any other skin disease or any disease for that matter, that does increase the chance. So, like for example, in COVID, when COVID was really prevalent, that time a lot of oral steroids were given to control the COVID infection, but that led to fungus infection, and that time it was even deeper fungal infections which were involved, like mucormycosis, if you would have heard. So yeah, yeast infections also thrive on high blood sugar levels.
Right. Now, doctor, let's also talk a little bit about skincare here. For the people who are suffering from fungal infection already, should they avoid their daily skincare, or is it okay if they do so?
So it's okay if you use soap, but what happens is if you're using so too much of harsh chemicals on the body is also not good. So I would advise them to use a mild body wash because that will help in
Hmm.
maintaining their skin barrier. What happens? People try to scrub. So there are homemade uh, tips and tricks which people try. They use a scrubber that disrupts, it damages the skin further, it irritates it, it helps the fungus to get deeper within the skin. So I would not recommend them using anything different other than the basic body wash, which just to maintain proper hygiene, then pat dry your skin instead of rubbing it. And yeah, that's that.
Right. So, are the regular products okay, or should they use? Uh, Again, we get such products in market which are
Yeah.
suggested by our doctors for fungal infections, say soap or any ointments or any sort of lotions. So, should they use such products, or the usual regular products are fine?
So the most commonly used powder in any Indian household is a powder with clotrimazole in it. So I would recommend not to use it. Just use a normal powder if you want for a daily basis. No need for medicated powders unless and until you have fungal infection. So what happens in a family is, because the powder is just lying around, everyone's constantly using that powder, thinking that it's going to help them stay away from the fungus. But what we don't realize is it is going to create a resistance just in case we were to get a fungal infection later on in life. That time you will be resistant to that clotrimazole because you've been using it on a daily basis. So I would not recommend giving a antifungal powder or a soap for that matter for people who do not have fungal infection. Now
Mm-hmm.
it also depends if the person is obese and is highly like they're highly likely to get a fungal infection, then I might tell them to wear, I mean, put that powder only during summer season. So there are a lot of ifs and buts while giving treatment. So I would recommend go to a dermat who will decide for you whether you should be using or not, depending on case to case.
Right. Doctor, what for the people who have a tendency of having ringworm on their feet? What are the kind of prevention they can take?
I would recommend to wear open shoes as much as possible, but there are few occupations where you cannot really wear open slippers and sandals and go ahead to work. So in that case, I would tell them to the days when they're not using their shoes, keep it out in the sun, or else keep it for drying, disinfect it with a spray, and then keep it for drying. Do not wear the same socks on a regular basis. Clean it. Do not wear moist socks. If you find that you're sweating, there are a few people who have hyperhidrosis, they sweat a lot, then I would recommend them to change the socks maybe once or twice in a day, and then take treatment for the excessive sweating too. And yes, do not share your socks and shoes with people if you are likely to get fungal infections.
What about walking bare feet? Can that also cause ringworm?
It can cause a lot of like other than ringworm, something which I would be more afraid of is a wart that can be caused because of walking bare feet. So I know people tell to walk on the grass in the morning, but it's not
Mm,
really. I do not recommend. It's a good. I don't think it's a good hygiene practice to walk on grass bare feet.
right. Well, moving ahead with the next question, doctor, comes from Sana, who asks, can fungal infection be treated by with probiotics?
Okay, so what happens is it cannot be treated with probiotics, but so the one of the main causative factors of fungal infection is when your normal skin flora is reduced. And when does that happen is when you're on prolonged antibiotics, maybe for acne or any other underlying infection. You're taking prolonged antibiotics. The good bacteria in your gut and on your skin, which are protecting you from these fungal infections, they reduce. So in that case, yes, probiotics will help. But if you're thinking that probiotics as a sole treatment for like a monotherapy for fungal infections, then I do not think that's the right way to go.
Right. The next question comes from Ram Gopal, who asks, can fungal lung infection be prevented?
It can see if a fungal lung infection that so the fungal lung infections only happen in cases where the person is severely immunocompromised. Maybe the person has HIV or uncontrolled diabetes, COVID, a lot of factors. These are like serious infections where more than the fungal infection, you're going to be more afraid of the symptoms like cough, dyspnea, breathlessness, uh, which might be prevalent, right? So yes, they can be prevented if you have all these things under control, uncontrolled diabetes and HIV. But that would be the first treatment. I mean, you need to get treated for that before the fungal infection can even manifest.
Right. Now, people who are watching us, we are again and again focusing today on immunity. Uh, how to build up the immunity, doctor? Can we give them slight a few tips, maybe, what they can implement on their usual regular life?
Yeah, I would. So now it depends on person to person, but I would recommend as far as possible, stay away from self-medicating yourself with antibiotic for every cough and cold you get, because many a times it's just allergic and people do not realize it, and then they just pop in an antibiotic. Sometimes it's viral. In that case, the antibiotic is anyway not going to work. So that would be my first measure. Do not self-medicate. Go to a doctor. Maybe if one sign which you can look forward to is maybe if the viral infection is getting cleared in a week. I mean, that's a normal flu. Do not take any antibiotic. If it's persistent and you're getting a yellowish greenish sputum, then that might be a bacterial cause. So in that case you can take an antibiotic. Do not take it for prolonged periods without the consultation of your doctor. And other than that, for building immunity, just eating healthy food, stay away from sugary foods as far as possible. Anything high, and it's not necessarily it should be sweet, anything which has high glycemic index, maybe of white bread or anything for that matter, they can lead to those insulin spikes and reduce the immunity. That is one thing. Eat clean and have a proper, like, follow a circadian rhythm. You have to sleep at a proper time, get up at a proper time, eat at a proper time. I feel only these basic measures here and there would boost your immunity.
Right. Yes, healthy food, fruits, vegetables, प्रॉपर अमाउंट ऑफ प्रोटीन, मेक श्योर आप सब कुछ इंक्लूड करें अपने डाइट में, चाहे वो प्रोटीन हो, चाहे वो थोड़े बहुत कार्ब्स हो, चाहे वो हेल्दी फैट हो, फाइबर हो. प्लीज ट्राई एंड इंक्लूड एवरीथिंग इन योर डाइट. Nowadays we see a lot of people who are on protein diet, strictly protein diet, no carbs, no fat. But are such kind of diet safe? Or as we are talking about immunity here, can uh, such diet be safe for the people who are suffering from a poor immunity?
I do not recommend only protein diets as ketogenic diet. Now it depends on person to person and their personal experience. So ketogenic diets, apparently, because they lead to rise in ketones, they have shown like they're really good for people who have Parkinson's or Alzheimer's, because the ketones are like boosting your memory. But on a regular basis, I really am not a strong supporter of ketogenic diets. I just eat healthy, eat normal, eat whatever is grown locally. That would be fine. I don't think you need to go for these fancy diets which just stay for like they are just they are followed by people because they are in the system, and uh, because social networks promote them. But I do not recommend following these diets.
Right. The next question, doctor, comes from Lucky, who asks, can nail fungal infections cause pain?
So if it is superimposed with a bacterial infection, then it causes pain. But just fungal infection, for that matter, doesn't lead to pain. It's usually asymptomatic, like no itching, no burning, nothing.
Right. And the last question comes from Priya, who asks, can fungal infection cause changes in skin color?
So yeah, if it is, basically it's an inflammatory process. So if it's a red inflamed patch that you have, when it settles down, it's going to lead to post inflammatory hyperpigmentation. So that in that case, yes, it will lead to change in skin color, but that's not a permanent change. It reduces with time. You can just apply a moisturizer, sunscreen, and that pigmentation will go away with time.
Right. I believe we had a wonderful discussion on the topic today. We got to learn a lot from you, Doctor. Before we take a leave, any take home message for our viewers who has watched us so far?
So I really wanted to talk about fungal infection today because it's such a normal, I mean, such a prevalent thing. And the first thing, the first measure in treating a fungal infection is identifying the symptoms
Mm,
like itching, redness. Because if the person doesn't know what is the symptom of a fungal infection, they're never going to go and take a treatment for it
right,
proactively. So the first signs,
right,
if you have any itchy lesion or red lesion, then it might likely be a fungal infection. And especially if someone else in the family or around you has it, it's definitely going to be a fungal infection. So it would be my I would like to convey this message to the viewers that if you have any itchy red lesion, just get treated before you spread it to someone else, because that will just help everyone in general.
Well, that was the expert advice for today, and that was Dr. Sonali Pinge for us. Thank you so much, Doctor, for your valuable time.
Welcome.
It has been quite an informative session for our viewers, and we look forward to many more such sessions in coming times. Also, thank you, viewers, for your excellent participation. For more informations and updates on skin health and care, stay connected on our Facebook page, All About Skin Wellbeing. We are also available on YouTube, Twitter, and Instagram. Thank you. Stay safe and stay healthy.